Hello everyone, my name is Johana Rodriguez and I'm the Multicultural Outreach Coordinator here at PPAL. And today I'm going to talk to you about sharing your family's mental health story. This is not an easy topic to discuss. However, your family's mental health story has power. But you might be asking yourself, why should I share my story? Well, with it, you can reach out for help, connect with families who have been through similar experiences, and build a community. With your story, you can create empathy in others by sharing your unique experiences or your unique journey. You can also reduce the stigma surrounding mental health challenges and impact positive change in services and policies. Yet, talking about mental health can be complicated and scary. So, what do families need to know about sharing their stories? First of all, you can ask yourself, why should I share my story? Well, to connect. Knowing what you are going through allows those with familiar experiences to reach out and you build a community. You can share your story to get help. Others can help you get through this if they know what you need. Also, to reduce stigma. Hearing your story can create empathy and compassion in others who may have less experience with mental health challenges. And when families who do have this experience hear you talking freely about your experience, they may feel more comfortable doing the same. You can share your story to help other parents. Parents with children with mental health challenges can learn from your experiences, whether the takeaway is how to work with insurance around hospital care or just that they are not alone. And finally, to advocate for change. Sharing your story with the media, government workers, and lawmakers helps pressure the system to change for the better. Now you may ask, where do I share my story? Start with someone you trust, a close friend or family member that you feel comfortable with, or start by sharing anonymously on a web page, especially for families of children with mental health challenges. Find sympathetic audiences. Join a PPAL or other support groups for parents of kids with mental health challenges. Or talk with your school's special education parent advisory committee. Other parents of kids with disabilities get it in a very unique way. Have you gotten comfortable and feel ready to talk about your experience further? PPAL is often contacted by the media looking for parents to share their stories. Consider calling PPAL and telling us you have a story to tell. We can help you amplify your voice. What are the concerns about telling your story? Well, whose story is it anyway? You might feel that the story belongs to your child and it isn't yours to tell. Think about your child's age. Talk to your child about their comfort level and consider focusing on your experience as a parent. And or using an alias for your child when discussing them publicly. Will I break down, you might ask? Are you afraid you won't be able to hold it together while telling your story? It can help to have a stock phrase ready, such as, I always well up at this point, or I get emotional every time. And remember that it is okay to have feelings. This is tough on you too. How will others react, you may ask? More and more people are becoming educated about mental health, but you can still get a few unhelpful or rude responses. Try to focus on how you tell your story. Being clear, making your points, and being satisfied with what you said may help you care less about how others will respond. Will it make me vulnerable, you may ask? Some parents worry that they might be judged or socially isolated if their community knows what is going on. Use your own best judgment. Sharing your story has many benefits, but only you know how much you should share. Again, I want to normalize and say that talking about mental health is never easy. But if you need additional support, please do not hesitate to contact us at www.ppal.net. And if you have a young adult who would benefit from our support in talking about their own mental health, please connect with Youth Move Massachusetts. Hope you have a wonderful evening. Good night.